Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 13th of April 2022. In terms of COVID inpatient numbers, today we are at 100. Last week we were at 124, so we're seeing an encouraging decrease, I would like to think, in those numbers. 91 patients in our general beds, 2 patients in critical care, 7 patients at Clifton. And it looks like the community numbers are coming down a little bit too. So last week we were up in the 800s for Blackpool, 700s for Fylde and Wyre per 100,000, and today those numbers are in the 400s for Blackpool and Wyre and just into the 500s for Fylde. So that would be a substantial decrease. The built-in error in that is that the amount of testing is going down because of the availability of PCR testing. But there's other survey data which does support the fact that the prevalence of COVID in the community is starting to fall. So, you know, they're encouraging signs, but we are still seeing people who are really poorly with COVID, and so by no means can we believe that it's gone away as a condition, as a serious illness. On that basis, vaccination, as you've heard me say many times before, is still thought to be the most effective intervention to keep individuals safe and protect the population. And wherever any of us are in that vaccination history, if we're due the next one, it's worth doing it. So the guidance moves around a little bit. The information is best found, to be honest, on the NHS UK website, and any Google search, if I'm allowed to say Google, will take you into the right space. At the minute, for example, if you're over the age of 75, you are eligible for a booster, and that's a really important part of protection for individuals and the population. And our vaccination centre at the hospital is open and actively immunising people all of the time. This week on our data, we've shown 14 new deaths associated with COVID, so within 28 days of the first diagnosis of COVID. Last week, I think I said we didn't have any on the data set, and sometimes this is a function of how they are recorded. But today we're showing 14 in the last 7 days. So as ever, thoughts go to families and loved ones of those patients who have passed and who have COVID in some way linked on the death certificate. Testing has become a bit more complicated, hasn't it? But the key message here is, for all NHS staff, free lateral flow tests are available online because there's a particular box to tick on the online ordering. And for anyone who's coming into hospital for a procedure, who is asked to have a lateral flow test before they come, those people can also get free lateral flow tests online. Again, there is a particular box to tick. So if you're due to have something done, then please will you go online and order some tests and get them delivered to your house. It's actually a very efficient system. It's just a question of following through the processes. Last week also I explained that we had escalated the hospital into our very highest level of surge escalation. It's called OPEL 4, and we declared that across the system. We've actually stepped that down in terms of our external partners, but remain extraordinarily busy. So we're still experiencing a lot of patients in our emergency department, trolley waits and so forth. So we're driving the organisation as hard as we possibly can. We're working very closely with our social care partners to optimise as many discharges from hospital as we possibly can. So I'm again asking for thoughtfulness and patience and perhaps forgiveness too in terms of our emergency department, because it becomes really so busy. Easter is coming, so to capture this in a slogan, I suppose we would talk about Home for Easter. and if you are the relatives or friends of a loved one who is in hospital and there's a possibility of getting them home for Easter, it's enormously important that we do that, both for those individuals because as I've said before, it's not great actually to be in hospital too long. We know muscle bulk is lost and outcomes deteriorate the longer people stay in hospital. But also most of us would much rather be in our own homes or care homes or our own places, familiar places if we can. So if you're able to help in that regard, it'd be much appreciated. That's called Home for Easter. We're talking about that all week. But in any case, I wish everybody else a happy Easter and I'll update again next week. Thank you.